Well, what it do there, YouTube? Tony Vogue, your friendly neighborhood e-boy, zombie slayer, who loves learning from the YouTubes. I don't know why I'm doing that intro so slow and dramatic, but that's how we roll it now. So we gonna
It's no secret that
find out
cancer
about
is one of the most
cancer
leading
and Elon
causes of
Musk.
death in the
Let's
world
do it.
today. This poisonous and deadly disease strikes fear in the hearts of many friends, families, neighbors, parents, and even colleagues. Yet despite many years of research, scientists and medical experts have been unable to find a cure for this menacing disease. Thankfully, in the midst of numerous research in recent years, there seems to have finally been a breakthrough, one that has managed to have caught the attention of one of the world's most innovative people, Elon Musk. You might know him as the man behind Tesla and SpaceX, but what you probably don't know is that the tech billionaire has also been keeping a close eye on revolutionary medical technologies. And recently he revealed a
Man, this channel, it's called Elon Musk Zone, and I might just unsubscribe because they dick ride Elon Musk so hard. All day. Every day.
shocking truth about a major breakthrough that could change the treatment of cancer forever. So, what did Elon Musk reveal, and what impact could it have on the heartbreaking disease? Cancer is a devastating disease that affects millions of people worldwide. It's also sadly the second leading cause of death globally, responsible for an estimated 10 million deaths in 2020 alone.
God
Given the
damn.
nature of the disease, most people are easily fooled into thinking that cancer is some disease that sprung out a few decades ago. But the truth is rather different, as the disease has actually been around for over 1,000 years. It was first recorded back in 1600 BC when a papyrus described a woman with a lump in her breast that was too hard to treat. For a disease that has been around for over 10 centuries, you'd think that scientists should have found a cure for it by now, but unfortunately the terrible disease has proven to be difficult to cure. This is probably why cancer patients continue to be treated using conventional means like chemotherapy and bone marrow transplant. Yet even with this so-called unconventional treatment that only the rich can afford, the survival rate of the disease remains slim. To further elaborate on that, it has been revealed that the American Cancer Society that the 5-year survival rate after a bone marrow transplant for leukemia, a type of blood cancer, is around 40 to 50% for adults and higher for children. And while we are grateful for the patients that have been saved, the treatments they are getting are not without limitations, something that continues to be a huge cause of concern. For instance, chemotherapy, which is a systemic treatment that involves the use of drugs to kill cancer cells, has become the most popular form of treating cancer all over the world. However, the downside to this form of treating cancer is that the drugs can also damage healthy cells in the process. These damages can often lead to side effects like hair loss, fatigue, and nausea, some of which can leave patients devastated, heartbroken, or even depressed. Another downside of this treatment is that cancer cells can develop resistance to chemotherapy over time, making it less effective, which is why scientists continue to hunt for a better cure to this deadly disease. Now, because chemotherapy cannot be effective for all types of cancers, scientists came about the other treatment, which is bone marrow transplant. Now, this refers to a procedure that involves replacing a patient's bone marrow with healthy bone marrow from a donor. But while this has proven to be effective in treating some types of blood cancers, it does come with its own risks, one of which is infection. You see, after a bone marrow transplant, patients are often put in an increased risk of infection due to the weakening of their immune system. In most cases, this is often due to the high-dose chemotherapy and radiation used prior to the transplant, a treatment capable of destroying the patient's existing bone marrow, which contains the cells that produce immune cells. So, without the existing bone marrow unable to function, the patient becomes vulnerable to infection until their new bone marrow can produce enough healthy immune cells to fight off disease-causing pathogens. Another complication is rejection. This refers to a situation
cancer is a very complex topic, but it's true, like, if we've been describing it for centuries now, we pretty smart, them human beings. I think we should have a way out.
Where the patient's immune system identifies the donor bone marrow as foreign and attacks it. When this happens, it means the bone marrow transplant has failed, and the patient will continue to fight for his or her life. And that's why it's almost crazy to hear that despite all these risks that come with the two best methods of treating cancer, they still remain the most common methods of treating cancer. That then brings us to an important question. If only 40 to 50% of adults survive the conventional treatments, what then will be the hope for other patients? This is a question that medical experts and the World Health Organization need to provide an answer to. The question is also proof of the need for more effective and less invasive treatments to improve the chances of survival for cancer patients. Scientists know this, and that's why they keep going back to the lab to find a better treatment for this killer disease. However, it appears that they might have just made a new breakthrough in cancer treatment, which Tesla CEO Elon Musk recently hinted at. According to reports,
what the hell? This boy not from this planet, I'm telling y'all.
This breakthrough involves a revolutionary approach that could potentially change the way we think about cancer treatment, and it all began with a 13-year-old named Emma Whitehead, who was cured of leukemia using a unique approach to cancer treatment. According to reports, the approach used to treat the 13-year-old involved genome editing and universal CAR T cells, which are genetically engineered immune cells that can target cancer cells in the body. This is done by introducing a modified version of the patient's own T cells that have been genetically engineered to express a chimeric antigen receptor on their surface. This receptor then enables the T cells to recognize and attack cancer cells that express a specific antigen. The universal part of this approach comes from the fact that the CAR T cells can be produced from healthy donors, rather than the patient's own T cells. The other interesting aspect of this treatment type is that a single batch of CAR T cells can potentially be used to treat multiple patients, which could make the treatment reach more people and be cost-effective, something that's been very difficult to replicate with chemotherapy. However, this new treatment is still in its early stages, and if everything we're hearing about it is true, then there's no doubt that it has the potential to revolutionize the way we treat cancer, and could offer hope to millions of people worldwide who are currently battling the disease. And with Elon Musk's apparent interest in this new technology, the future looks very bright. Speaking of the Tesla CEO, it's really no surprise that a man like him is interested and perhaps even excited about this new development. But before we dive into all the details about the Tesla boss, it's important to know about how the CAR T cells treatment for cancer came about, and what it means for the future of cancer research.
So let's find out about
lies in the
CAR T.
collaboration between Great Ormond Street Hospital, or GOSH, University College London, and other leading institutions in the field. Together, these institutions conducted the first of its kind clinical trial that tested the new genome editing and CAR T cell therapy on a 13-year-old girl with leukemia, and the results were nothing short of remarkable, as the white T cells actually began targeting and killing cancer cells without hurting each other. Almost all hope had been lost for the 13-year-old Emma until this new treatment decided to give her a good shot of a normal life as she became cancer-free. As great and incredible as this sounds for Emma and her loved ones, it's important to note that the significance of this achievement goes beyond just one patient. That's because this breakthrough opens up new possibilities for cancer research and treatment that could potentially lead to a cure for many more patients in the future. More than anything, this development of CAR T cells using bioengineering technology goes to show the importance of collaboration and innovation in the medical field. It also reminds us that there is always hope in the face of even the most daunting of challenges. Just as Elon Musk is hopeful and stays committed to the course of finding a cure to the disease. The tech billionaire has a reputation for reading up and making inquiries on new technologies that are capable of making positive impacts on society. So it's no surprise that the tech guru has taken a keen interest in the incredible cancer trial that recently made headlines. In fact, Musk was quick to share his excitement about the news on social media, tweeting that it was incredible and that there's hope for so many people. But Musk didn't stop there. He also expressed a desire to get involved in the development and commercialization of this technology. In response to a tweet about the trial, he wrote, "I'd be happy to fund half of it if you can find the other half." With Elon Musk having millions of loyal followers, it was not much of a surprise that his tweet quickly gained attention, with many people praising Musk for his willingness to invest in such an important cause.
Guys, look at this. Elon Musk sure setting him up to be like the goodiest person on the goody planet, but damn, he seemed to be doing a lot of good for the world. He can put up half that money, man. Where the pharmaceutical industry been? They've been trying to kill y'all.
But the question you might be asking yourself now is, why is Musk doing all of this? After all, for someone who manages two of the biggest companies in the world, Tesla and SpaceX,
Trust me,
including his
that's what
newly
I've been
acquired
asking.
toy, Twitter, surely he has enough on his plate to put too much attention on some research about cancer that he saw on the internet. Well, that's the thing with cancer. It's a disease that even the richest people in the world are powerless against. And for Elon Musk, it's no different. Most people are unaware of this, but Elon Musk himself knows what it feels like for someone really close and dear to his heart to fight cancer. That's because his mother, May Musk, is a survivor of breast cancer and has been an advocate for cancer research and early detection ever since. So, Elon Musk donating half of the funds needed for this new treatment isn't just a matter of philanthropy for the SpaceX founder. He also has a personal stake in finding better treatments for the disease.
Okay.
With Musk's involvement in this development, the future appears to be bright.
I
This
mean,
is
that
largely
explains
because,
one
as the founder and
do-good
CEO
thing.
of both SpaceX and Tesla, Musk has a proven track record of bringing groundbreaking technologies to market. In other words, many of the necessary resources and expertise needing to bring this new cancer treatment to a wider audience would be provided by the Tesla boss. However, this isn't to say that this new technology has answered all the questions about cancer treatment. In fact, there are still a lot of questions about this technology, especially its safety and effectiveness over the long term. Still, it'll be interesting to see how this whole thing plays out in the next few years. Whatever happens, the good part is that Musk is likely to be very much involved in some part of the process, no matter how little. After all, it won't be the first time that the tech guru is getting himself involved in making of cutting-edge medical innovations.
Oh, damn.
Back in 2016, the Canadian-born billionaire founded a company called Neuralink with the goal of developing technology capable
Musk
of
is
connecting human
Canadian-born?
brains directly
Didn't
to
know that.
computers. This would be done by creating what Musk calls a neural lace, which would allow humans to communicate with machines in a seamless, natural way. This neural lace involves implanting small flexible threads of electrodes into the brain, which can then detect neural activity and transmit data to an external device. These threads are much thinner than human hairs and are designed to minimize damage to the brain tissue. In addition to their use in brain-machine interfaces, the threads could also be used to treat neurological conditions, such as epilepsy, depression, and Parkinson's disease. Musk has stated that he believes that developing neural implants and brain-machine interfaces is essential for humanity to keep pace with the rapid advancements in artificial intelligence. He has also expressed concern that AI could eventually surpass human intelligence and become a threat to humanity, and that he sees neural implants as a way to enhance human cognitive abilities in order to keep up with AI. While the technology is still in its early stages, Neuralink has made significant progress in developing its neural implant technology. In 2020, the company demonstrated a working prototype of its implant in a pig, and it has plans to begin human trials in the near future. So, with Musk's involvement, what is in the future for cancer patients? Well, with this new breakthrough in cancer treatment, the potential implications for cancer research and future treatments are quite immense. The 2020 pandemic changed the world. It altered the course of humanity and changed the way we live, work, and interact with each other. But despite
Drop me a subscribe if you're glad the pandemic's over. If you don't drop me a subscribe, I'll consider you among Team Pandemic, you know? You like the pandemic. Ew.
the fact that most of us survived the virus, we have had to deal with its terrible aftermath, a severe national health crisis. Elon Musk has been one of the loudest voices about this crisis, and in recent times he has proposed innovative solutions and actions. What are these solutions and how can they curb the crisis? Let's find out. Elon's entry into public health has attracted widespread attention due to his track record of transforming industries and pushing the boundaries of innovation. The very fact that he's interested in the crisis has brought much needed attention to it, and as anyone would expect, his immediate response was to look for a solution to the problem. But what exactly is this health problem, and how did it get as bad as it currently is? To answer these questions, we need to look into the contributing factors that have led to its growing chaos. One of the major factors is the aging population. Advancements in health has meant increased life expectancy. However, at the same time, birth rates have declined. This means that we now have a high proportion of elderly individuals in the population, whose number is putting immense strain on healthcare systems. And that's because older adults typically require more frequent and specialized care. The situation is further worsened by age-related illness like dementia, osteoporosis, and heart disease, which increase the demand for medical services, long-term care, and support. Another reason for the national health crisis is the increasing prevalence of chronic disease such as diabetes, cardiovascular disease, and obesity. These conditions have increased due to poor lifestyle factors such as physical inactivity, poor diet, and tobacco use. Chronic diseases not only reduce the quality of life for millions of people, but also place a significant financial burden on healthcare systems. These are the factors that make up the national health crisis, but it goes beyond the increasing occurrence of chronic conditions. There's also the increasing cost of managing and treating these conditions. It has resulted in skyrocketing healthcare expenditures that has strained both public and private resources. But somehow it gets even worse. There is also the issue of inequalities in healthcare access, and it's often determined by socioeconomic status, ethnicity, and geographical location. It's unfortunate but true that these factors will be more often than not influencing a person's ability to obtain high-quality healthcare, especially in America. People with lower incomes, minorities, and those living in rural areas often face barriers to obtaining medical services, including lack of insurance and fewer healthcare providers. This issue is further worsened by the shortage of healthcare professionals. This has to be one of the most underestimated contributing factors to the national health crisis. As the demand for medical services continues to grow, there's an increasing need for qualified doctors, nurses, and other healthcare workers. However, and in recent times, the supply of these professionals has struggled to keep pace with rising demand. Factors such as an aging workforce, burnout, and inadequate training opportunities have contributed to the increasing shortage. As this imbalance between supply and demand has led to longer wait times, reduced access to care, and increased stress on existing healthcare workers. But somehow it gets even more complicated because the emergence of mental health issues has come with its own issues. It has become a crucial part of the national health crisis while remaining a growing concern in recent years, which has done nothing but strain the healthcare systems. Depression, anxiety, and substance abuse have become increasingly common among individuals across all age groups and demographics. Unfortunately, the stigma surrounding mental health and the lack of adequate resources for treatment and support have only worsened the situation. There is no denying that the rise in mental health struggles not only affects individual well-being, but also places a tremendous burden on families, communities, and healthcare systems. However, all these factors reached a new height in the wake of the pandemic of 2020. The pandemic triggered an increase in the pre-existing mental health crisis, further maximizing the challenges for everyone involved. The pandemic brought about significant changes in our daily lives, including wearing masks, staying indoors, and practicing social distancing, resulting in a new normal. Unfortunately, the adjustment to the changes brought by recent events was an unsettling task for many. It took a significant toll on many people's mental health, as they found themselves clouded with constant uncertainties and anxieties on a daily basis. Now, when you add all of that with the burden of navigating through political conflict, racism, and economic downturn, you'll begin to get an idea why the situation has only worsened. And why many would insist that the national health crisis America is facing is actually an escalating mental health crisis. And they might be right with their assessment. In recent years, these issues have affected individuals and communities across the country in ways that transcend the abilities of physical healthcare. And it is in the light of this that Elon Musk has emerged. He recognized the urgency of the situation and has initiated several projects aimed at fixing this crisis. One of Elon Musk's groundbreaking endeavors is the development of Neuralink, a brain computer which aims to transform the treatment of neurological disorders, such as stroke, spine issues, and dementia. As a neurotechnology company, Neuralink's primary focus is on creating advanced brain-computer interfaces, or BCIs, that hold the potential to transform the treatment of neurological disorders, as well as enhance cognitive functioning and facilitate seamless communication between humans and machines. By implementing ultra-thin electrodes into the brain, Neuralink's cutting-edge technology will evade rapid data transfer between the human brain and external devices, ultimately unveiling limitless possibilities for medical treatments and human enhancement. Now, before we continue any further, it's important we note that this isn't the first time Elon is speaking up or lending his expertise in the wake of a health crisis. During the pandemic, Musk's companies leveraged their manufacturing capabilities to produce ventilators and other essential medical equipment. Beyond their contributions to the pandemic response, Elon Musk's companies have long been committed to addressing the natural health crisis through their core missions. Elon Musk, who leads both Tesla and SpaceX, has extended his healthcare initiatives to include telemedicine, recognizing it as a powerful tool to enhance healthcare access, especially for underserved populations. Telemedicine is practically just remote healthcare aided by technology such as video conferencing. With the launch of Starlink, a high-speed satellite internet service by SpaceX, telemedicine services have been taking a new dimension. Healthcare can now extend to remote areas with limited connectivity, enabling patients to connect with healthcare providers from anywhere in the world. However, despite the potential benefits of this technology, some criticize Musk for his lack of skill in healthcare and medicine, as well as his potential conflicts of interest in medical innovation. Specifically, Musk's lack of expertise in these fields has been a key point of criticism. Their major argument is that as a successful figure,
I think the most important thing here is conflict of interest, because this man just go in any industry.
In tech and space exploration, Musk's opinions on healthcare and medicine may not be rooted in sound scientific principles, which could be misleading to the public. Furthermore, there is the issue of potential conflicts of interest. Many believe that his financial investments in companies like Neuralink, which are developing medical technologies, could cause issues down the road. However, despite the concerns regarding research integrity in the innovation process, Musk's unwavering commitment to healthcare and medical advancements within the United States remains unshaken. His companies have collaborated and established strategic partnerships with various organizations and government agencies to strengthen their efforts in addressing the national health crisis. One such example is Tesla's partnership with local governments and educational institutions to promote sustainable transportation and renewable energy solutions. By working together, these collaborations have resulted in the development of advanced energy storage systems and the promotion of clean energy education. Similarly, SpaceX's Starlink project has been instrumental in bridging the digital divide and providing global internet access, enabling telemedicine and remote healthcare services. Through partnerships with governments and nonprofit organizations, Starlink has expanded its reach into underserved populations, ensuring equitable access to healthcare resources. Now, if we're going to give critics a proper response, it's important we take a step back to consider Elon's past collaborative efforts and how they might determine the trajectory of his influence on the current national health crisis. Predictably, this takes us back to 2020 in the pandemic. One of these major contributions, as we highlighted earlier, was manufacturing life-saving ventilators. In March 2020, Musk announced the procurement of 1,255 FDA-sanctioned ventilators from China, which was air-shipped to the University of California in Los Angeles. Additionally, he vowed to utilize Tesla's engineering facility for the creation of further respiratory devices. As the pandemic unfolded, ventilators became gold, leaving numerous nations to scramble for them. By initiating mass production, Musk corrected this imbalance, equipping healthcare facilities with essential apparatuses to preserve lives. This greatly reduced the pandemic's consequences and reinforced his dedication to using his resources and expertise for the greater good. Using this as context, we could say that the initiative demonstrated Elon's willingness to leverage his position and influence to make a meaningful impact during a time of crisis, and that it served as a testament to his commitment to drive innovation and progress in the face of adversity. However, ventilators weren't the only highlights of Musk's contributions to general health during the pandemic. We've already mentioned the contribution of satellites and telemedicine. But Musk went beyond all of that to push for the development of effective therapies and vaccination for COVID-19. His steadfast commitment to finding solutions to the pandemic was evident in his conviction that a vaccine would be made possible by the end of 2020. In fact, in May 2020, he publicly announced his personal intention to receive the vaccine once it became available, demonstrating his confidence in the scientific community and the potential for innovation to overcome even the most intimidating of challenges. His claim was met with doubt given the complexities of creating a remedy for a virus that was pretty new at the time. Nevertheless, an array of vaccines has since been designed and distributed globally. While Musk's push may not have directly led to the creation of the vaccines, his advocacy for scientific advancement and personal commitment to vaccination potentially strengthened public trust in its safety and potency, and this is worth something. Building on this momentum, his initiatives, which have over the years leveraged on cutting-edge technology, have the potential to transform healthcare and improve the lives of millions. Through the use of technology to improve outcomes and make healthcare more accessible, he could assist in reducing healthcare costs and enhancing patient outcomes. Furthermore, his patient-centered approach could help to improve the overall patient experience, further reinforcing his dedication to making meaningful and lasting.
Bruh, this guy, this channel I'm gonna unsubscribe. That's my reaction to the amount of dick riding there is here. But this is
Contributions to the
crucial
national health
information.
crisis. Of course, there are
But the
challenges
dick
to Musk's
riding, though.
initiatives. The healthcare industry is notoriously complex and heavily regulated, and it can be difficult to navigate for even the most experienced entrepreneurs. However, if there is anyone capable of bringing groundbreaking distribution to the healthcare industry, it's Elon Musk. His remarkable track record in leading groundbreaking ventures is proof of his visionary leadership and steadfast commitment to innovation. Time and time again, he's proven his ability to drive transformative change across a wide variety of fields. As Musk continues to apply his extraordinary problem-solving skills and forward-thinking mindset to the realm of healthcare, the possibilities for impactful advancements become increasingly evident. The advancements resulting from his efforts in addressing the national health crisis could lead to breakthroughs in disease prevention, treatment, and overall healthcare delivery, making a lasting impact on the lives of millions around the world. As these innovations continue to unfold, the potential benefits could extend far beyond the immediate crisis, paving the way for a more resilient and responsive healthcare system that can effectively meet the needs of diverse populations. But what do you think?
Well,
Will
shit.
Elon's contribution to the healthcare sector
I think you need to talk about something other than Elon Musk, my friend. That was fascinating. We learned a lot about Neuralink, about the pandemic, sheesh. And this video was actually about cancer research. What a video. I am your boy Tony Logan. Stay away from the Elon Musk zone. Jesus. God.